Young adults in their 20s and 30s make up the largest group of COVID cases in San Diego County. Doctors say it's a growing trend across the country, and they caution young adults to follow health guidelines. News 8's Heather Hope spoke to a young patient who just recovered from COVID-19 and shares her story.
I have no idea how I got it, honestly.
Working from home in software sales, Carly Anders in Golden Hill says she is still trying to figure out how she contracted coronavirus at 29 years old.
I think like a lot of other people, we took it really seriously for like the first 6 weeks, and then did start loosening up, spending some time with some friends.
The healthy, avid runner suddenly had achy muscles, chest pain, and shortness of breath.
Then it kind of got progressively worse to the point where I'd wake up in the middle of the night and feel like I couldn't breathe.
She tested positive for COVID-19 on May 17th and instantly worried about her fiance she lives with and their friends.
But of everybody I saw, no one else ever developed any symptoms. I was the only one to test positive.
The County of San Diego COVID-19 triggers for modifying health orders confirms the age group impacted the most is not the elderly, but those 20 to 29 years old account for over 3,200 cases, or 22.5% of our local population. And then those in their 30s are the next largest impacted age group.
The number of young people that are getting hospitalized, it's certainly not zero. It's not zero. There are young people that do get hospitalized and unfortunately succumb to this.
Dr. Abisola Alulade of Sharp Reese Steely says most young adults aren't seeing severe symptoms.
Someone could not have symptoms, especially young people, and still spread it to others.
Her advice to those wanting to go celebrate the 4th of July is to watch your distance, wash your hands, and wear a mask so that someone else doesn't have to wear a ventilator.
Coronavirus is still pervasive. It's invisible. You can't see it, so a lot of times it's hard to have that realization that it's still here and it's still affecting us. But it doesn't care if you don't remember that it's around. It's still spreading.
Carly and her fiance quarantined for 14 days and both just tested negative for COVID-19.
I'm in the clear now, it would seem, but I still use the inhaler a couple times a day, so I have some lingering symptoms.
She fears she could get coronavirus twice.
I really hope that there is something to that antibody immunity and that we're in the clear for at least a little while. Just keeping in mind that if you are someone that's planning to go out and celebrate this weekend and you might get sick, stay away from your parents and from your grandparents for at least a couple of weeks or until you get a negative test.
Heather Hope, News 8.